This video is about OET speaking for nurses. If you have been practicing short, robotic role plays, stop right there because in the actual OET, your ability to sound natural, supportive, and clear is what makes the difference between a B and an A. So today, we are going full exam mode with realistic nursing scenarios that will test everything like empathy, reassurance, clarity, and your ability to explain complex information in simple English. Let's dive right in. The first one is reassurance. This means calming the patient's fear or uncertainty with supportive, realistic words. It's not about saying, don't worry. It's about showing understanding and confidence. So you first need to acknowledge their emotions. I can see why you'd feel anxious about that. Then you can give a fact based reassurance. That tiredness is common after surgery and usually settles in a few days. So, here the purpose is to build the trust, reduces anxiety, showing you care and know what you're doing. And the next one is information giving. This means explaining medical information clearly, accurately, and in plain English. Let me tell you how to show it. Try to use short and simple sentences and avoid or explain big medical jargon. Explain it hypertension, that means high blood pressure. Okay, and you can use logical structure. First, you will need to rest, then start gentle activity after 48 hours. This is an example how you should provide it in a logical way. And then the purpose for this one is this criteria ensures patient understanding and safety. This one is an important OET criterion. The third one is professional empathy. Empathy is emotional understanding, right? Professional empathy means doing it while staying calm and composed. You can express understanding without overreacting. That sounds upsetting. I would feel the same in your position. And you can balance emotion with professionalism. Don't sound overly emotional or casual. Okay? And the purpose of this criteria is to demonstrate emotional intelligence and patient centered care. Okay? And the next one is organization. This means presenting information in a logical, easy to follow order. Disorganized responses confuse patients and lower your OET score. So you have to use sequencing words such as first, next, after that, okay, and address one topic at a time. Don't mix wound care with diet advice. And keep explanation structured and smooth. And the purpose of this one is to show clarity of thought and helps the patient remember the instructions. The next one about clarity. This one is making your speech clear and simple so the patient fully understands it. Okay, so you have to speak naturally, not too fast, and you can rephrase if the patient looks confused. You can tell, like, let me put it in another way, and you can just rephrase the term what the patient didn't understand. That way, it would be helpful for the patient to get the things in a better way. And the next one is supportive tone. So, tone matters as much as words. A supportive tone is warm, calm, and encouraging, even when delivering bad news or correcting your mistakes. Okay? So, keep your voice gentle but confident. Try to use kind words. You have done the right thing by checking, or you can use phrases in order to show your kindness. And smile naturally because that affects your tone even in a test. Okay, and the next one is information sequencing. This is a specific communication skill, giving information step by step in the order the patient needs it, not in the order that you want to deliver. Whatever the patient requirement, as per the flow that you have to give it, right? So you can say, like, first wash your hands, then remove the old dressing, after that apply the new one, and try to use linking phrases that create flow and logic. Okay, and the next one is professional calmness. This is the ability to stay composed, polite, and positive even when the patient is upset, angry, or confused. Okay, so don't interrupt or argue when the patient is talking to you. Try to be calm and use reassuring phrases like, let's take a look together. We'll work together to fix it soon. Okay, use some of the reassuring phrases and maintain even tone and respectful language. Okay, now the next one is error correction. This means identifying and correcting patient misunderstanding gently without sounding or blaming or dismissive. You can use the phrase like, I see where the confusion come from. Actually, the dosage is twice a day. Let me show you. Okay? You have to focus on clarity, not fault. So this prevents medical mistakes while preserving patient dignity and non-judgmental. When a patient admits a mistake or unhealthy habit, you must reassure without judging it. That's pretty important, right? You can avoid words like should have or you didn't. Don't use these words. You have to encourage a positive steps instead. That way, you can keep the communication open and help the patient feel safe to share. And the next one is motivation. That means encourage patient responsibility and positivity. And giving clear explanation. That means you can use analogies and confirm their understanding. Okay, let's move on to an example here. So this is the role play one post-operative care and the setting is patient recovering from gallbladder removal feels weak. Patient is saying like, nurse, I'm feeling so exhausted. Is this normal? I thought I would be walking around easily by now. And the nurse is saying, I understand your concern completely, Mr. Allen. It's normal to feel that way after surgery. Your body has been through a lot. Everyone recovers at a slightly different pace. But my friend had the same surgery and said she was fine after one day. Why I'm still feeling so weak? That's a very good question. Each person's recovery depends on factors like age, general health, and even how your body reacts to anesthesia. Fatigue at this stage is quite expected. Your body is using energy to heal internally. You will feel stronger in the next few days. So there is nothing to worry about. Not at all. As long as you're eating, passing urine normally, and your wound looks fine, which it does. I'll keep monitoring you closely, and I'll also arrange a short walk later today to gently build your strength. All right, that makes me feel better. I'm glad to hear that you're doing well. Slow and steady progress is the goal right now. Okay, so this one is the role play for a scenario after the post operative care. Here, you have shown reassurance, information giving, professional empathy, and you did not dismiss the worry of the patient, right? You have normalized it and provided physiological reasoning. That's exactly what OET examiners allow reassurance plus explain plus support. And let's move on to the next role play. This is the discharge advice wound care. You're preparing a patient for discharge after knee surgery. He looks confused about how to clean his wound at home. Nurse, I'm worried I'll do something wrong with the dressing. What if I mess it up or it gets infected? That's a very reasonable concern, Mr. Patel. Let me walk you through it step by step so you feel completely confident. Okay, thank you. I just don't want to cause any problems. Of course, first, before touching the dressing, wash your hands thoroughly with soap and water. Then gently remove the old dressing and check the wound. It should clean and dry. If you notice redness, swelling, or discharge, don't panic. Just call us immediately. So, in this example, you have demonstrated organization, clarity, and a very supportive tone, right? The nurse provides instructions logically using the sequential words first, then, and then she also used phrases like if you notice, which shows information sequencing, which is a main key in OET criteria. Plus, You reassured emotionally, not just clinically. Okay? So that's how you handle real OET speaking case like a professional nurse. Remember, this test is not just about fancy vocabulary. It's about the connection, clarity, and compassion. Always acknowledge the patient emotion first. Then you can explain clearly using simple, structured sentences. Reassure without sounding robotic and check understanding in a very natural way. If you can master those four skills, you're not just passing OET, you are becoming the kind of nurse every patient remembers for the right reasons. So keep practicing with empathy, structure your responses with logic, and most importantly, speak like a caring professional, not a textbook. Because in OET, empathy is not optional, it's the secret weapon. That's all for today's video. Kindly like, share, and subscribe for more OET tips. See you in the next video. Bye bye.